it's like a death. It's like you've lost the person that you knew. And so having to go through course of a childhood, losing 6 siblings to it was pretty severe trauma. And I always found this remarkably confusing. Why are all these folks out there that are high functioning and are affected by schizophrenia? And my brothers were so low functioning. And it's the combination with the anosognosia.
Bob Kolker, the author of Hidden Valley Road, had never heard of anosognosia. In the HBO documentary, they don't mention it. What are your thoughts about that?
No one over the course of their lives did any of these top researchers in the world ever explain anosognosia to our family.
If you think that more people knew about anosognosia, do you think there'd be an increase in compassion?
Absolutely.
Yeah,
absolutely.
Welcome to the Spotlight on SMI. I'm Dr. Xavier Amador, and today I'm really happy to be joined by Lindsay Roche. She is a member of the family that was featured in the book Hidden Valley Road, the best-selling book, and also an HBO documentary. Lindsay is one of 12 siblings, 6 of whom had schizophrenia. Most important to me, frankly, is she is an ardent, enthusiastic, powerful mental health advocate and a wonderful speaker. I've had the great honor and pleasure of working with you, Lindsay, in our nonprofit to educate people about anosognosia and about LEAP to engage people in treatment. So it's a long introduction. Thank you for being here, being a part of this.
Thank you for having me, Javier. I'm overjoyed to be on with you.
Thank you. Well, you're a big part of the launch. So you grew up with 6 brothers. You're the youngest in your family, right?
Mm-hmm.
Yeah.
Yep.
And 6 of your brothers developed schizophrenia. How did you learn, like at what age and in what way, what was said to you about your brother's illness?
It was more the experience of it firsthand. Being a very small child, 2 or 3 years old, my eldest brother, Don, came home from college unwell, and he was terrified, and my parents were terrified. And there was no way for me to understand at that age that what he was saying wasn't real. He believed that the CIA agents were outside our home and had it surrounded, and he was trying to protect us. And
so you were scared as well as a little girl.
Yeah, there was no way for me as a child to differentiate between what he was saying being real or not. And so that it was terrifying. And my parents were confused. I think they assumed he was on drugs. It was that time in history where drug use and psychedelics were very, very popular in a college setting. And so I think that was my parents' first go-to, was that he just must be hallucinating on
drugs.
Recreation.
That's such a common experience in my work clinically with families. And with my brother Henry, who had schizophrenia, that was my first theory, is that he had somehow done psychedelics or some other drug. At what age and in what way did you start to understand this was a psychiatric illness, a brain disorder? Do you remember?
I would say as a pretty small child, I would say by the time I was 5, I had been living with it for long enough. And I think my parents had explained that it was an illness. That's how they described it. It was a brain illness. And although they were, of course, searched for answers for decades and decades, and, now I've taken on that role of continuing to search for answers. They were able to embrace it as an illness of which they needed professional help. And they really turned to psychiatry. They were unable to turn to psychology as a result of the schizophenogenic mother that my mother was labeled. And she was too smart for that. She turned her back on psychology as a result of that.
For those who don't know what the schizophenogenic mother is, by the way, when I was in training, I learned about the schizophenogenic mother. It's mothers who give double bind, mixed messages, create schizophrenia. It came out of psychoanalysis in the 30s, 40s, 50s. Schizophrenia has nothing to do with how one was parented. It's a brain disorder. It's a neurodevelopmental disorder, just like Alzheimer's.
It's really interesting. You still see that strong tendency to blame mothers in media. and from just average Joes who don't know, general public still has a tendency to blame a parent.
Right. Well, and not as bad as that, but also common is thinking schizophrenia is split personality and not understanding. Again, this is a neurodevelopmental brain disorder. As you got older, how old were you when your last brother developed schizophrenia of the six of them?
I was 16.
16.
So, yep, I was 16. So over the course of from age 2 to 16, I watched my brothers, one after another, every few years become affected.
Okay. And was engagement and treatment what people typically call compliance? And right now I'm just talking about medicines. Was that an issue? Were they all reliably in treatment? I have high blood pressure. I take my medication every day.
Nope.
No.
Only one of my 6 brothers was compliant with his treatment. My brother Joseph, he was the last to become unwell, and I was away at high school. I went to boarding school as a result of my brothers living at home. And he was the only one, and maybe it was because he was so much older in his life that he had gone through watching his siblings develop this brain disorder, that he was able perhaps in real time to recognize that he had it. I'm not sure what the difference was with why Joseph did not have anosognosia and my other 5 brothers did. Although we don't really know about my brother Brian because he committed suicide at age 22. So there's really not a strong way for us to know if he did or did not. Right. We just assume that he was non-compliant. But
yeah, I'm sorry about Brian. I can't help but get on my soapbox again about how we talk about suicide.
By suicide instead of committed. I know.
Well, people die. People die from all kinds of medical conditions like cancer, heart disease, and my view is it sounds like it's yours too. He died from the illness. Yeah.
Yep. Definitely.
But it's hard to break that habit. I know. I recently said somebody committed suicide. Yeah. And it's
hard to break that one for sure. Working on it though.
Good. How did your parents, and when you were 16 for that matter, try to help your brothers stay in treatment? What was that? Confrontation, intervention, calling the police to pick them up? What were the attempts like?
Yeah, the attempts were pretty much, you may not live here if you do not take your medication.
Okay, so tough love.
Yep. So they would go back to the hospital. They'd come home medicated, stable. They'd go off their meds, just the constant revolving door. At some point in the history, as much as an adult, finally, probably in my 30s, so I had spent 30 years with this non-compliance, they started to be compliant and live independently, except one brother never lived independently. But I don't know if it's just having gone through that rotation over and over and over and over again, and they were just so unwell. And I believe there were probably court orders involved in their taking their medications.
Okay, so some involuntary treatment. In my experience, also when people have anosognosia, this unawareness of having the illness, through repeated hospitalizations, it's almost like a surrender. Like, okay, everybody wants me to be in treatment, so I'll do it. I wonder if that might have been.
I mean, to this day, my brothers, the 2 remaining, do not believe that they have schizophrenia. They still suffer from anosognosia, but they take their medications. And, one is almost 80 and the other one is 65. So
why do you think they take medication? I mean, I know we're kind of talking about it, but they don't believe they're ill, and I talked about this in our first podcast. My brother attributed it to his relationship with me. That's why he is in treatment, even though he never understood.
Yeah, I think they attribute it to the requirement by the nursing home they're in. But my brother Matthew, when he lived independently, before he went into nursing home, he took his medicine. And I don't know why. That's, that's a good question. Because he, to this day, says he doesn't want to.
Yeah. I'm a big proponent. The research indicates my experience personally with my brother and my clinical experience with patients is that relationships are the key to helping people accept treatment for an illness they're sure they don't have. So if Matthew doesn't understand he's ill, I just wonder if your relationship with him is having an impact.
Yeah, that's a really good question. I mean, the amount of conflict, and I've said this to you, but just for the record, the amount of conflict that existed in our home over taking medication was tremendous. I mean, enormous. It was chronic and disruptive and caused for a lot of violence in my home that could have otherwise have been avoided had my parents been aware of this condition, anosognosia. And I didn't become aware of it until a friend of mine, after the book came out, watched your TED Talk, and he sent it to me. And I picked up the phone immediately after having watched it to call you and say, thank you. Thank you.
You're welcome. Yeah, a lot of people have seen the TED Talk and have told me it was really helpful in terms of lowering the temperature in the family and not getting so angry at the person. I mean, would you ever tell somebody to stop hallucinating?
Yes.
You would.
I would bang on the wall.
Oh, stop yelling at the hallucinations. That's different.
Stop talking to them.
Yeah, that's different.
Just stop talking. It's 3 a.m. I have to go to school tomorrow.
Yeah.
Stop talking.
But we don't tell people to stop hallucinating because we know they don't control it. And it's the same thing with awareness of the illness. We tell them just, admit it, stop refusing to acknowledge, when it's not that somebody's refusing to acknowledge their ill, it's that they don't have the knowledge. They don't see it.
For me, the most important part of my experience was that I got help myself.
Tell me about that.
I started therapy at age 18 when I went to college. I realized that I was having trouble maintaining relationships. I was having panic attacks. I had a lot of nightmares, and eventually was diagnosed with PTSD as a result of having both having been sexually abused and raped, and also having grown up in this environment where I'm watching one after another of my siblings be hijacked, kidnapped by this brain disorder, and seeing that. And, everyone describes it when you're a sibling, and this best of all, it's like a death. It's like you've lost the person that you knew. And so having to go through course of a childhood, losing 6 siblings to it was pretty severe trauma. And I spent 25 years in therapy, learning how to manage my anxieties and my neuroses that I had developed as a result, like, rearranging furniture and putting all my socks in order in my closet. And it's a little OCD.
Those are things we can control, right?
Yep.
Can't control the sexual abuse, the trauma of losing one brother after another to this illness.
And, I want to address the sexual abuse issue because that bothers a lot of people. The 4 youngest of the siblings in our family were sexually abused by one of our older brothers who was schizoaffective. And he was sexually abused by priests as a child. And sexual abuse is generational trauma. It gets passed on. And just because he ended up being a perpetrator, there's no correlation between his brain disorder and being a perpetrator. And I just want to reiterate that because there's a lot of people out there that are upset at our family for having brought schizophrenia and sexual abuse into the same picture frame. But the reality is sexual abuse crosses all dimensions of society. Yes. Whether you're schizophrenic, whether you have cancer, whether you have, you name it, all demographics and income structures. I mean, it's just prevalent. And so the chances of somebody with schizophrenia becoming a perpetrator are probably substantially lower than somebody that does not suffer from schizophrenia.
That's my
and
understanding as well. No, I think that's really an important distinction and clarification to make. My oldest brother didn't want our brother Henry to be anywhere near his kids because he was worried, completely unfounded for no reason that I can identify, that he might abuse his kids. And I
My
tried to.
sister still has the perspective that actually, I would say most of my siblings kept their children at a distance from my affected brothers.
Right. Well, the thing is, psychosis is scary. People are talking about conspiracies, or they have grandiose delusions, and you're seeing someone who's not sharing the same reality that we're sharing, right? Not in touch with the reality as we understand it. And so that's just inherently a very scary person to be around until you understand it better. Yeah.
And particularly because they're usually so often distressed
Right.
about whatever it is they're experiencing is causing them so much distress and you don't know how you can help, which is where you come in.
Well, you mentioned, I was just going to ask you, you mentioned the referral you got to my TED Talk and to my book, I'm Not Sick, I Don't Need Help. And I know we've talked about it before, but maybe you could say a little bit about your feelings about not, and I know Bob Kolker, the author of Hidden Valley Road, and he and I have talked several times. He was quite upset that he wasn't hearing from the experts that he reviewed. He did an incredible review of the research in that book. Mm-hmm. He had never heard of anosognosia. You had never heard of it. I know in the HBO documentary, they don't mention it. What are your thoughts about that? What are your feelings about that?
My parents got very involved in research in the 80s and early 80s, late 70s with NIMH, National Institute for Mental Health. And no one over the course of their lives, and 6 of their sons having become affected by schizophrenia, did any of these top researchers in the world, I mean, top brain researchers in the world, ever explain anosognosia to our family, to my parents. And when I learned about it after Hidden Valley Road came out, I was horrified. I was embarrassed. I was ashamed that anosognosia was not a part of that book, because it could have brought the conversation to such a broad audience. I mean, that book was a huge success because it helped bring serious mental illness to the general public in a way that was palatable, I guess. Mm-hmm. It was intriguing. It was interesting because it wasn't a textbook. It wasn't dry.
It's human stories.
Yeah. It's a human story, a family story, a multi-generational story. And it reads like a novel. It doesn't read like a nonfiction book. Right. And so it was very well received, and anosognosia not being a part of it is really a tremendous failure on everybody's part.
And, in defense of the author, Bob Kolker, and the experts that he interviewed, I'll say, as an academic researcher, we all operate in our silos. So my silo was really interested in this lack of insight, lack of compliance. I also, though, had a broader silo, a larger silo, working on the DSM, the diagnostic manual that we all use. And so that got me a little bit beyond. But when you're just working on genetics or just working on brain imaging, et cetera, like the experts that Bob talked to, in their defense, you're not reading the broader literature. And that's why I'm so grateful to you for having this conversation, because our hope is that more people will learn about the research and learn about the impact.
And I think, to defend the researchers, and even today, when I was speaking with the Semel Institute, when the book first came out, there was a psychiatric resident that was on the line who reached out to me afterwards when I spoke about anosognosia and said, "Thank you. Mm-hmm. It's so just, it's a couple paragraphs in all of their textbooks that they're learning about. And so it's not brought to the medical school programs with any real significance." And I think that educating psychiatrists about the importance of it, they're looking at a million different disorders, not just schizophrenia. And I think also it's confusing and I always found this remarkably confusing. Why are all these folks out there that are high functioning and are affected by schizophrenia, and my brothers were so low functioning and their schizophrenia was so severe? And it's the combination with the anosognosia. And that's what I also would like people who are affected by schizophrenia and not anosognosia to be advocates for those who have anosognosia, because they are the strongest voices that we have.
When I work with peer specialists that you're talking about, people with lived experience who are advocates like we are, I often point out, you don't have this symptom. That's why you're in recovery. That's why you're an advocate. And please don't forget your brothers and sisters, and it's about 50% of all people with these diagnoses. And in your family's case, it was 80, 90% that had anosognosia. Yeah. If your parents had known about it, how do you think it might have affected, how they talked with their sons about treatment?
Oh, I think it would have been of enormous benefit to them. I think it would have provided them with your approach. The LEAP approach would have provided my family with an invaluable tool that would have enabled so much of the conflict in our home to have been avoided. And it would have been a tool that we as younger siblings would have observed and would have picked up on and would have learned, as kids do. They replicate what their parents do. And I see it when I go to the nursing homes with the nursing staff. They don't even realize they're doing it.
Right.
But because they work with this population on a day in and day out basis, they've developed these school skills of how to communicate with somebody without even knowing that's what they're doing.
It's anchored in compassion. When I used to work in a nursing home when I was much younger, and I just remember my fellow staff members. I worked in activities. I ran bingo and did the nails of women. But I remember there was this culture we had of just being compassionate and caring and concerned. Mm-hmm. And I think when you have that as your foundation, listening and understanding the person's perspective, that's the L in LEAP, right? Actively listening comes naturally. So I'm not surprised. So you think maybe your parents might have.
Oh, they would have embraced it.
Mm-hmm.
Yeah, absolutely. They would have embraced it. They would have had such a sense of relief of not understanding why, if this brain disorder makes you so dysfunctional in your life, why not take the medicine? Right. They just were absolutely perplexed and infuriated. And, the chronic anger from them towards my brothers for not being compliant with their treatment occupied an enormous place in our home that it didn't have to.
In our home also, and with me, for 7 years, I was really pissed off at my brother. I was really angry. I didn't understand until I stumbled on anosognosia and neurological disorders and made the connection to what was happening with my brother. I was frustrated with him. I thought he was being stubborn and difficult, in denial, immature, and I was far from compassionate.
So, I think all of us siblings that were unaffected felt the same way.
Right.
Anger towards them. And, my mom always tried to get us to not be angry at them, but at the brain disorder.
Yeah. How I kind of started thinking about it? It's like, would I be angry at somebody? And I have two friends with Alzheimer's. Angry at my Alzheimer's friends because they can't remember things? No.
Yep.
Yep.
I have a friend whose husband has early onset, and you wouldn't yell at them. Now when somebody has Alzheimer's and they, folks don't try to create conflict with them anymore. Mm-hmm. They just say, oh yeah, okay, no, we need to turn the oven on to 350. Right. As opposed to, I told you already to turn the oven on to 350. Right. Damn it.
Right. I told you to take your medication for schizophrenia. Yeah. Why aren't you taking it? Right. Instead,
Yep,
yeah,
exactly.
that's a great analogy. It's really interesting.
Yeah.
Let me change the topic a little bit. Um, did your brothers all have the same symptoms? Because one of the things that, as a scientist that we know is that schizophrenia is a very heterogeneous disorder. You have people presenting sometimes with hallucinations and others who only have delusions. Some with a lot of
Hmm.
negative symptoms, like flat
Hmm.
affect, and some who have
Hmm.
no negative symptoms. What was it like for you with your brothers?
I think that is what made it so confusing to my parents that, when you have strep throat, you have all the same symptoms.
Right? Throat
And
hurts.
if they were being diagnosed with this brain disorder, why did they all present so differently? For instance, my brother Jim was originally diagnosed as bipolar and took lithium. And over the course of his life, his thinking became more and more delusional. And only in the end, when right before he passed away, was he really having visual hallucinations, audio and visual hallucinations. So he started off as bipolar and then changed to schizoaffective and then ended up full blown hallucinating audibly and visually
Right.
closer to his middle age. And then my brother Peter, again, schizoaffective disorder, he never had visual or audio hallucinations, ever, just delusional thinking. And very manic, very manic, really trouble, difficulty sleeping. He, had a very, very strong manic component to his, and, then it became psychosis. And, um, and then my brother Joseph, who didn't have anosognosia, he was such a quiet and calm and gentle person. He never was agitated. He didn't have that agitation in him. And all he would say, because he didn't have anosognosia, he'd say, if only the voices would stop, Mary, I would be okay. If only the voices would stop. My brother Matthew, who finally was able to take Clozapine in his early 40s. He was diagnosed at 18, and he finally, in his early 40s, started taking it. And he said it was like waking up from a nightmare.
For those who aren't aware, Clozapine is the only unique antipsychotic that we have. It's been around for 50 years. And I can say anecdotally, I've seen it improve anosognosia. There's one study showing that it does tend to improve that lack of awareness. So that was Joseph's experience.
No. Unfortunately, Joseph was unable to take it. I had two brothers that couldn't take it. They had grand mal seizures while on it. And Joseph was one of those, but he just didn't have anosognosia, even though he had full blown schizophrenia, audio and visual hallucinations and depression. He never had any sort of the manic component that Peter had, where he would ride his bike, 200 miles and, in a night kind of thing. And then Matthew was probably, even though he went on Clozapine at 40, he still maintained the anosognosia. I think the damage to the brain had been so severe by that point already that he was never able to really regain a high level of functioning regardless of the medication. Which I know now, now that early intervention component and compliance is so critical for these kids. If my brothers had just had that, I mean, what a world of difference it maybe could have made for them, and not having had.
Do you know what the average duration to first treatment is? How many years?
Yeah, I read that recently somewhere, like 6.
7 years.
7
years is the average
7
before
years.
people who have the illnesses your brothers had, and my brother had, get their first treatment. In Henry's case, it was probably about 5 years before we recognized that he needed treatment. He'd benefit from treatment.
My parents said, in looking back, my brother Donald at age 12 attempted suicide. But in those teen years when he lived at home and he was in school, he somehow was able to maintain, even though my mom in retrospect says there was something going on, but it wasn't full blown. And of course, it wasn't until he went to college that he became really unwell. But she said she seemed to think there were some things that maybe she could have picked up on had she had the knowledge.
Right. Well, I'm going to circle back to what you were talking about earlier about you were wondering about why did one brother have insight awareness and the other five had anosognosia. You actually just made the case these disorders present in so many different ways. And anosognosia is a symptom just like a hallucination, uh, difficulty sleeping, high energy, delusions. Some people have some of the symptoms. It depends on the parts of the brain that are affected. So anosognosia is sometimes, oftentimes part of the picture, but not always. Not always. Yeah. And your experience really makes that point. You took care of Peter, and you still do, right?
Peter passed away.
Oh, I'm sorry. I forgot. I
All right.
apologize.
Yeah, he passed away October. He'll be a year this October.
That's right.
Renal failure from long-term use of lithium.
Yeah,
So his kidneys failed. And it's funny because he's the youngest, and my eldest brother Don will be 80 this year, and he's still alive and well. He presents very, he's very catatonic. He's very withdrawn. He really has chosen to live within his delusions because I think he finds it less stressful to just live in them than try to battle them. So,
if I recall correctly, the kidney failure was in part or large part due to the medications he was taking.
Yeah, absolutely. Yes.
Yeah.
Long-term use of high dosage of antipsychotics and lithium. And, Bob Friedman, who was one of the main researchers in our family, said because of Peter's chronic non-compliance over the course of his life, the dosages had to keep going higher and higher. All my brothers were always on the absolute maximum dosage of medication. It was also, they became unwell during the era where over-medicating was just standard.
Very common,
And so then they became what is called, I guess, brittle is the term they use for somebody that can't miss a dose, or they just go into a full-blown episode. My brothers were very, very brittle from the chronic non-compliance. And eventually the high doses have really been responsible for killing 3 of my brothers. And that's tough for me because I know the medications are so important and so critical, but these folks have schizophrenia. They're not stupid. They understand that these medications are causing harm to them. Yeah. They understand that long-term use of high doses of antipsychotics has a comorbidity component. And 2 of them have died from what our family identifies as neuroleptic malignancy syndrome. Wow. That was not diagnosed in 2 of them in an emergency room. Yep. Right. They were sent home. EKGs were negative, but it doesn't show up on an EKG. So,
but they died from NMS, from neuromalignancy syndrome. The thing that I think about a lot, talking now with thousands of people like your brothers in my work, is that we have to care and pay attention to and address side effects. And chronic use of high dose antipsychotic medication is a big problem that was a mortal problem for your brothers. But like any medication, if we pay attention to the side effects, we can mitigate, we can avoid those negative consequences.
And I think, my understanding, and correct me if I'm wrong, is that psychiatry has learned a hard lesson from that, and has now tries to maintain much lower doses of these medications.
Absolutely. When I started my work in the 80s, the doses were 2-3 times higher than what I see now. And there's a reference in the clinical community, we would talk about chemical restraint, because you didn't want to physically restrain people who were agitated and throwing chairs at staff. So you do, quote, chemical restraints, which were very high doses of antipsychotics, and that has changed. That has definitely changed.
Yeah, all my brothers were definitely, that was part of their treatment plan. Unfortunately, they all slept 20 hours a day at times.
Wow. Yeah, that's not optimal treatment. No. What about treatment? What do you see? I mean, you have a wealth of experience. And since then, as a mental health advocate, you've also talked to hundreds, if not more, families. What's your expert opinion about treatment? What's needed? Is medication enough?
Oh, absolutely not. Absolutely not. And that was really um, a failure of psychology at the time for my
Hmm.
parents, because those of my siblings who were affected, as well as those of us who were not affected, would have benefited enormously from therapy as children. It would have really helped us understand what was going on. It would help us process and come to terms with and overcome the grief that's involved with having a sibling.
Hmm.
Um, it it became such a critical component of my life, and my sister had quite a bit of therapy, and I had quite a bit of therapy, but my none of my brothers have. None of them to this day. I think they're part of that generation where it's was seen as a weakness for
Hmm.
men to seek help, mental health help, which is really too bad, because I think they would have had fuller and richer relationships with their spouses, with their children, with themselves, if they had had the opportunity to have therapy that would help them just go through the emotional processing of what it's like to grow up in a family like mine. And since the book came out and since the HBO series, I have had endless and endless and endless support and appreciation from other families who are surprisingly quite similar. Um, Big families with, your chances of having more than one, if you have a big family, are higher, where there have been a parent or multiple siblings. And they've said, it's so hard to help people understand what I've been through. And it's only people that have been through it. And I've been shocked by um, how much support. And the thing about the HBO series I was really, really bummed about is I think it still swayed people to think that my parents had were somehow responsible. I think it didn't avoid that neurological Grand Canyon that people have around kids that are unwell. It didn't explain anosognosia, and I was adamant that it do so. It put it on full display. My brothers wanted to be in that series because they wanted to talk about the dysfunction of the system and how the system has been as damaging to them as the brain disorder itself. And they didn't really, I think in the footage that exists, but it didn't get put in the series. And I was really, really upset about that. And again, the third piece with the sexual abuse being unrelated to having schizophrenia.
Right.
And those were kind of my
Clarifying
big
that, emphasizing that. Right.
emphasizing it. And so, yeah, I was, it didn't, but it does, I have to look at the lemonade glass half full with the HBO series, because it got people talking about it. Uh,
And
so
talking to you, an educated advocate.
Yep. So it's got the conversation going and continuing, and that's the best we can really, as advocates, that's really what we're trying to do, is have people openly talk about the difficulties and the answers.
Yeah. Well, you mentioned the broken system and how your brothers would have liked to have talked about it. You are an advocate. What do you think needs to be fixed?
Oh.
If you could wave your magic wand, what would you fix?
I think we really need to separate psychological disorders from serious mental illness. I think combining everything into one big basket is a mistake. The anxiety that a kid has going to school, the school aversion, and the eating disorders, and I call it the yoga mom anxiety, and very not serious mental illness needs to be separated from that basket of narcissistic personality disorder and PTSD. And even I believe strongly that combining serious mental illness with drug abuse is a major, major mistake, because you're putting these folks with a serious mental illness in the same basket with drug abusers. It's not helping them. It's not helping either those who are serious drug and alcohol addicts with those who suffer from serious mental illness. They are not one and the same. And I think they've been lumped
together. Yeah, it hurts both kinds of people.
Number two, we need housing. How can you expect somebody to overcome any illness, you name it, cancer, heart disease, AIDS, any serious illnesses, if they don't have 3 square meals on the table and a roof over their head and a warm place to sleep? They don't want to live on the streets. They're not choosing to live on the streets because it's something they want. They may say that out of pride, but if they were given the option for a warm place, and it's why many of them, I believe, commit crimes to go to jail, to be in prison, because it's easier to be in prison than to be on the street and have no food and no place to sleep. And of course, our prison system is not the right location for anybody with a serious mental illness. It's causing more harm and more trauma to this person that is unwell. And I just, at the NIMH conference, just in June, I sat with a woman in tears whose son is in a hospital in Utah, and he needs his Clozapine, and he can't get it because they say they don't have the care structure, which many nursing homes say the same thing. They won't take somebody with schizophrenia because they don't have the care structure for them to be on.
And all that is, let's be clear, is a blood draw.
Yes, it is a simple blood draw. I think once a month, maybe, or a blood draw once a month. So here, this poor mother's son is suffering from serious audio and visual hallucinations in a prison in Utah, and he's being refused the care he needs. That's what's criminal. That's what's criminal, not the person that committed a crime. The crime is being committed within the prison with the patient.
We could do 2 episodes just on this issue. So many people with schizophrenia and related disorders end up in the criminal justice system. I think that was the experience you had with Peter.
Yes, it was. He left. He was actually hospitalized and left the hospital and came to Boulder and was out in front of a 7-Eleven and was delusional. And a police officer approached him, asking him questions, and he was answering in ways that didn't make any sense, saying he was born in the 1800s. Your typical delusional behavior. The police officer was unable to recognize that he had a serious mental illness. And she approached him in a manner that was aggressive and elevated the conflict, caused more conflict. And he eventually struck out at her and was convicted of hitting a police officer, which of course is a felony. And he was delusional, and the police officer had no tools to de-escalate the situation.
Him, calm him down.
She didn't have any tools. There was no training at that time. And I had to fight like hell to get Peter the care he needed outside of the criminal justice system. And fortunately, Sheriff Epp, who was the sheriff in Boulder County at that time, really became involved in getting his officers training on how to recognize and what to do. And this was back in the early 90s. This was long before there was any serious training for first responders around serious mental illness. And so he was really, I will give him credit for having been a pioneer. He came to at that time, it was Colorado Alliance for the Mentally Ill. And he had his training officers come to the programs after that.
It's so important because I worked on the mobile crisis team with the Tucson Police Department. And the officers were so grateful to me because they didn't have the tools like this officer that escalated Peter and ended up with him striking her. And at Leap Institute, we've trained probably thousands of police officers. And one of the first things we teach them is to recognize mental illness, but then how to talk to the person, how to reflectively listen, tell me what's going on, and talk to them about what their delusion, perhaps, or voices are telling them is going on, and then move them from the criminal justice path into the mental health treatment path.
Well, and unfortunately, we've got, because our prison system is often, I don't know what the percentages are, a for-profit situation.
Mm-hmm.
And the large psychiatric hospitals cannot make money. That's what we've chosen to do as a society, and is put these folks in prison instead of in hospitals. And the shutting down and the defunding of the psychiatric hospitals is also, a huge, huge problem. It's why they live on our city streets. I mean, our city streets are hospital wards.
Mm-hmm.
I mean, it's ridiculous.
Well, and the largest inpatient psychiatric facility, I think, is still Los Angeles County Jail.
Yeah. And I met with a gal who was the psychiatrist for the Texas prison system, and I forget what she said, that it's like one psychiatrist for every, I don't know how many patients.
Hundreds.
Some absurd. Hundreds and hundreds.
Yeah. Lindsay, is there anything else that you would change if you could about the mental health care system?
Yes, absolutely. The enforcement of parity laws with insurance companies. I think that the laws exist, but there is no enforcement of them. And I think the insurance companies find it easier to pay the fines involved with not paying for mental health care than pay the doctors.
Right. They'll pay for your diabetes, but not for your schizophrenia.
So that would be another serious thing that I would like to see happen.
As a family member, thinking about the broken system and what you would change, did you ever hit the brick wall of HIPAA where you were trying to tell us about that? Tell
us. My poor parents. I mean, how can a psychiatrist care for a patient who doesn't believe they have an illness, but also can't talk to the parents of that patient or sister? Yeah. I mean, I had a mom in California reach out to me a couple years ago whose son became unwell and ended up in Denver in a hospital, and she could not get through to anybody to speak to them. And as a result, he was discharged with no plan, nowhere to go. And it's really, really a problem that we have got to change the HIPAA laws around serious mental illness and family members being able to be involved. I guess there was something that just happened in Arizona with, was it Angry Moms?
Mm-hmm.
Was able to get some law changed around this issue in Arizona. So,
to make the legislation made HIPAA a little bit more permeable, so that information could pass to the primary caregivers, which are us as family caregivers.
And the continuum of care, that information has to be able to pass. So how is that psychiatrist in that emergency room going to know what medications are helpful to this person?
Unless they talk to you or the parents. He's been tried on A, B, C, and D, and you're trying him on B, and he's been on it 3 times and it never helped.
Right. Exactly.
It's crazy. If anything's crazy, it's the system. Anything else you would fix if you could wave your magic wand?
More beds, more psychiatrists, more compassion in our society for those who are affected. I think there's a real callousness that our culture has created around those, the whole pull yourself up by your bootstraps. Well, most of these folks don't have bootstraps.
Right.
They don't have bootstraps.
Or boots.
For which to pull or boots.
Yeah.
And so I think trying to generate greater compassion for those affected and their families is really important to me. I think the lack of compassion in our society for the homeless, for the drug addicts, for the seriously mentally ill is morally bankrupting us. financially bankrupting us as well.
Mhm.
It's costing us more money to do it this way than if we just made some investments in the care of this population. And it would also help all of our conscience. It would make us all more compassionate and caring for one another. We've become such an ugly culture. It's really very, very sad. And I want to try to be at that heart of that change. And so helping to educate the general public, which is why our family chose to tell our story.
Right.
Why Bob Kolker's book was such an enormous success was that bringing that understanding to the general public is so important. And stop blaming parents, because I think our society still really does that.
I want to add to that. Stop blaming the person with the illness, that they brought it on themselves. I've heard that also.
Oh, yeah.
If you think that more people knew about anosognosia, do you think there'd be an increase in compassion?
Absolutely.
Yeah.
Absolutely. I talk about it constantly. Every chance I get, to people, here was a good one. I was going to visit my daughter in downtown Denver, and this young man who was obviously unwell and had a serious mental illness was on the street, and he was hallucinating, and a guy in his, obviously a person that it was just coming home from work and going out on a jog and had his headphones in, and this kid was trying to ask him for money, and the guy that was jogging just yelled at him. I mean, absolutely went off at this poor kid. And I ran after the guy that was jogging, and I tapped him on the shoulder. I said, "Can I speak to you?" And I told him about anosognosia. And I told him this kid obviously was affected, and that his approach was not helpful.
And what was the reaction you got?
He apologized.
Really?
He apologized and said he didn't know of it, had never heard of any such thing.
Wow.
So that moment with that one individual who was, just angry at this kid for begging,
Right.
who was obviously delusional. That one moment he was able to go, oh, wow.
So how can we get you running after more people? Where can people go to learn about what you do?
Go to the Leap Institute, .org.
Okay.
That's where you go. You go to the Leap Institute, you get Dr. Amador's book, and that's the biggest resource I can think of. Watch Dr. Amador's TED Talk. It's brilliant. I tried that little trick you do on folks that in the audience.
The role play where we make people delusional. Yeah.
I got someone pretty mad at me for doing that.
Yeah.
It was pretty upsetting to them.
Yeah.
And if you want me to come speak at one of your programs, I do have a speaker website now that I just started. So it's lindsaymarygalvinroush.com.
Wow.
That's a mouthful, isn't it?
Lindsay Mary Galvin Roush, R-A-U-C-H is how we spell Roush. Okay.
Yep. And I just made it myself on
Fantastic.
Squarespace, so.
I'm going to bookmark it right now. Just to wrap up, if you had one bit of advice for family caregivers, for siblings, what would it be?
I always say, put on your own oxygen mask on first. If you're not taking good care of yourself, you can't help care for them. So you need to provide self-care and that includes therapy.
And get there. I was in therapy for more than 20 years as well. So I took your advice without knowing it. And if you had one bit of advice to give to clinicians, people treating people like our brothers, what would it be?
Learn how to communicate using the LEAP tools.
Didn't know you were going to say that. You know what my advice would be, actually?
What?
Talk to family members.
Oh,
involve them, engage them.
Yes, absolutely. I now, this is something I don't think my parents ever, and maybe I could be wrong. Maybe they did, and was a child, and so I was unaware of it. But I have a care conference with my brother's nursing homes once a quarter. And So I'm engaging with their doctors and with their nurses on a regular basis so that we can address not only, I mean, I think not only their serious mental illness problems, but they're just everyday medical problems get completely overlooked because the person with serious mental illness can't communicate that they have a medical issue that needs attention. My brother Don lived with a UTI until he became septic because he was unable to explain to the nurses what he was experiencing,
Right.
Out of shame or just he was delusional around it. So there are medical conditions like the neuroleptic malignancy syndrome that somebody with serious mental illness cannot explain to a medical practitioner. And so often these medical issues get, I think I've told you this story before, but just along these lines. My brother Matthew showed up at the ER with symptoms of heart failure. They were going to send him home. And this was during COVID. And I said, there will be blood on your hands. I've had 2 brothers die. And I demanded under no uncertain terms that he be admitted and given a full cardiac workup. Mm-hmm. He had heart surgery the next day.
Wow. So if you had not been there,
they would have sent him home. If I had not had that communication with the doctor in the ER. And I had it because when my mother passed, I went to each of my brothers and got a durable medical power of attorney so that I could speak to the doctors when they became hospitalized for their psychiatric issues or for their medical issues.
Yeah. Getting a medical power of attorney, getting conservatorship, these are really good tools for penetrating HIPAA.
It prevents somebody from dying by suicide if a parent can speak to the care practitioners.
Lindsay, I can't thank you enough for doing this. And I hope
absolutely.
This will be the first of many more conversations.
Yep, I hope so.
I'm excited about it.
I'm always honored to be able to talk with you. You've taught me so much.
Well, and if people, one of the things TAC is set up is if people want to ask me questions, propose other, and you're invited to do this as well, other podcast topics, they can call 703-294-6005. So 703-294-6005, and leave me a message, and we just launched a blog. I'll be answering questions on the blog. And like I said, we may include it in an upcoming podcast. So thanks again.
Okay. Well, thank you for having me. I'm really grateful.